Hello, dear. Yes, that is right. My name is Dr. Cordelia. Please, have a seat. Yeah, right over there. Oh, and take your coat off if you'd like. This room runs warm. Okay. So, I have read your form you filled out, and to sum it up, you've been feeling unwell for 3 weeks now? Fatigue, tightness in the chest, trouble sleeping, and difficulty concentrating. Oh, and you wrote general sense of unease. That's descriptive, not especially helpful, but we will work with it. Okay, let's start with the basics. Yes, we will start with a general examination to see where the problem lies and if we can find any indicators for it. Alright, please sit up straight for me. Yes, there we go. Good job. I will start by listening to your heartbeat. So it might get a little cold, but please bear with me for now. Can you lift up your shirt for me, please? Okay, good. Don't get startled. Don't worry. It'll be over soon. Okay. Go ahead and breathe in for me, dear. And out. Good. Again. Your rhythm's nice and even. No skip beats. If there was anything cardiac going on, I'd hear it immediately. So that's good. Okay. One more breath. You're doing very well for me. Lungs sound clear all the way through. No crackling, no wheezing, and no delayed airflow. Which tells me you're not fighting an infection. That's interesting. But just to make sure, I'll now listen from your back, okay? It'll be cold again, but it'll be right over. Okay, then please turn around a little. There we go. Alright. Please relax. Keep breathing normally. Again, nice and slow. Nothing here either. Okay, let me write that down. Okay, no abnormal days with the breathing or the heartbeat. Okay. Then, okay. Just to make sure, let me check your pulse manually. Oh, sorry if that startled you. I hope it's okay that I'm touching you. Your pulse is strong, and the circulation seems to be good. Your hands are warm, very warm, and your skin tone is healthy. Okay. So, no problem in that regard so far. Let me take a quick look at your ears to see if I'm missing something. Is that alright? Yeah, I have this little metal tool that will help me look into your ears, but again, it's going to be a little cold, so please bear with me. Okay, let me start with the right ear. There we go. Hey, you're doing good, but I don't see anything. Okay, let me look at the other ear. Real quick. No, nothing there either. That's odd. Okay, thank you for that. So far, there are no problems in your heartbeat, or you don't seem to have any sort of fever or infection. But don't you worry, we will find the root of your problems and fix them. After all, that's why you came here, isn't that so? Okay, very well. Then let me check your reflexes next. Good. Normal responses. And in both legs, nothing is delayed. Very nice. Let me take a quick note of that. Reflexes are in good condition. Next, I would like to take your blood pressure. I don't know if you're aware, but it's one of our fastest windows into how your heart and blood vessels are doing, and it can tell us a lot about your condition. Okay, rest your arm right here. Yeah, just like that. I'll just put this around. Please try to keep it relaxed. Okay, the cuff will inflate and the machine will measure your blood pressure. So please hold still for a moment. It'll be over soon. Okay, let's see. Your blood pressure is a little elevated, but not too much to be hypertension, which is usually something that raises the risk of heart disease or kidney damage, which luckily is not the case for you, which is really good. But it can also come from chronic stress, which is why I'd like to know if you're stressed very often. Not really. Okay, that's interesting. Let me note that down. Elevated blood pressure, but no feelings of stress. Okay. Okay, next I'm going to check your shoulders and neck quickly. Just stay seated. Okay, let me I'll press with my hands on your shoulders. And you just tell me if there's any pain when I press. How about here? No. Good. And how about here? Just a little step. Okay, I see. Alright. And if I press right here by your neck, anything? No. I see. So in short, I don't see signs of infection. If this were viral or bacterial, you'd be dealing with fever, inflammatory markers, or at the very least, fluctuations in your energy that come in waves. You don't have that. Furthermore, nutritional deficiencies would show up in your blood pressure, your reflexes, your skin tone, and yours are all well within normal range. Cardiac issues don't behave like this either. Heart-related fatigue doesn't ease when someone sits close to you, and it doesn't worsen primarily at night. Okay, fine. Then the reason has to lie somewhere else. I wonder what it is. But rest assured, I will find the root of this. But for that, I have a few questions. So let's talk about your routine. How many hours do you sleep? And the quality? Well, I mean, do you wake up feeling rested? Or do you still feel tired? Thought so. And do you wake up during the night? I see. Any caffeine intake? Okay. How many meals during the day? Okay, 3. Do you exercise? No. You're doing everything right. Don't worry, dear. I'm just noting down to make sure I'm not missing anything. And for that, I'd like to check your posture real quick. Please just stand up. Right there is fine. Okay. Relax your arms. Yes, like that. Interesting. Oh, nothing. It's just you don't even notice you're doing it. You're holding yourself slightly forward, like you're bracing. It is very subtle, but usually I see it in people who spend a lot of time anticipating things or that worry a lot. Do you worry a lot? I see. Okay. The patient, posture, worry. Okay. Oh, you can sit back down. Thank you very much. Okay. I'm going to ask you a few more questions now. And I want you to know that I'm not changing topics. This is all still part of the examination. Do you live alone? How often do you speak to someone face to face? not work-related. I say, and think about this for a second, please. When was the last time someone touched you without needing something from you afterward? I'm sorry if that question is very straightforward, but I promise I'm getting somewhere. So please just answer the question. You have nothing to be ashamed about. Over here. Alright. That's enough. Well, I can tell you, there is nothing physically wrong with you, which leaves something less visible. Touch starvation. Before you react, yes, it is real. Your symptoms align perfectly. Elevated stress response, disrupted sleep, chronic tension without cause. Your body is waiting for something it isn't getting. So this isn't something I can treat with medication. But it is treatable. The most effective method is controlled, safe physical contact. Pressure, warmth, stillness, regulated breathing. In simple terms, your nervous system needs reassurance. Cuddles, if you want to say it in layman terms. When people hear touch starvation, they imagine loneliness and in a very dramatic sense, but that's not what this is. This is your nervous system spending too long without neutral, grounding contact. Over time, your baseline stress level rises because your body stops getting one of its primary signals for safety, oxytocin, which normally helps keep stress hormones in check. I can demonstrate if you want. You're free to decline, of course, but based on your condition, I recommend it. Hey, look at me. It's nothing to be ashamed of, dear. You hear me? God, nothing to be ashamed of. So, are you okay with me treating your touch starvation? Good. Very good. Then sit a little back, please. Yes, just like that. Very good. Okay. I'm gonna place my arms around you. There we go. You can rest your head on me. That's okay. There we go. Good job. Is it okay if I rub your back with my hand? Very well. It'll be very soothing. There. You know, this is the part people always underestimate. Physical contact, I mean. They assume that it's optional. Something nice, but not something necessary. Which is medically incorrect. Skin-to-skin contact activates mechanoreceptors, specifically C-tactile efferents. They're slow-conducting nerve fibers designed only to register gentle, intentional touch. Comfort, if you may want to say it like that. They don't even exist for efficiency. Evolution kept them because, well, I guess because they work. Those signals go straight to the insular cortex. That is the part of your brain responsible for emotional regulation, self-awareness, and, yes, unfortunately, feeling safe. When those pathways aren't stimulated, cortisol levels rise, heart rate variability drops, sleep becomes shallow, fragmented. People come in complaining about chest pressure or fatigue, and their labs are pristine because the problem isn't the heart, it's the absence of touch. There are studies, premature infants gain weight faster when held. Elderly patients recover quicker with regular physical contact. Even the immune response improves. Natural killer cell activity increases. So in sum, your body expects touch the same way it expects sunlight, or rhythm, or breath. And when it doesn't get that, it doesn't immediately go into a panic mode. That's not the case. But it waits, and it waits, and it waits. And then it starts sending suggestions. A tight chest, restlessness, a feeling like something's wrong, but you can't explain what. And then people apologize to me for wasting my time, as if this isn't exactly my field. Oxytocin releases during sustained contact isn't just about bonding. That is the simplified version. It is actually about downregulating the amygdala. Your nervous system stops asking, am I alone in this? Right now, yours has stopped asking. I can feel it. Your breathing changed. Oh, sorry. That was observational, not personal. Occupational reflex. Anyway, cuddling isn't indulgent. It's preventative care, which means this counts as treatment. And if anyone disagrees, I can cite at least 12 peer-reviewed journals and one very angry neurologist who would back me up. Alright, I'll stop lecturing. Just stay where you are. You're doing perfect for me. Yeah, you are. You don't have to hold yourself together right now. I've got you. Sorry, did that startle you? I put my hand on your chest to measure your heartbeat. And your heartbeat is slowing. Nice. You know, I don't get patients for touch starvation often. Not because it's rare. I mean, there are a lot of people suffering from it, but usually they don't come in for it, or often they decline cuddles because they are ashamed or whatever reason. So it has been a while that I gave this type of treatment. So I'm really happy that you came in, because whatever applies to you applies to me as well. And I enjoy the cuddling. And I was wondering, as you can tell, I'm a Kitsune, so I was wondering if you'd like that I wrap my tail around you. I promise it's very fluffy, and it will make everything even more relaxing. Yeah, the warmth and the fluff of my tail. Yeah, you'd like that? Okay, and I shall do that. There we go. There we go. Like that. Good job. There, I've got you. Don't worry. This isn't a one-time solution. Well, we'll have to schedule follow-ups. You'll have to come in for your cuddle sessions frequently. After all, touch starvation can't be treated within a day. But for now, just stay in my arms and let you rest. No, don't worry. You're my only patient today. Yeah. Well, as you know, this far in the countryside, you don't get patients very often. So, it's really no problem. More so, it's my pleasure treating you. But hush now. Just close your eyes and let your body feel this, and take in your treatment.